Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical practice. Now, today we're going to talk about the third trimester, okay? So I assume when you've gotten this video, you've either had your sugar test, your glucose tolerance test, or you're about to if it's appropriate. And there's a separate video to tell you more about those details. What comes next? Well, you may also have received your whooping cough vaccine as of 2022. That's recommended, and that can come this visit or in your next subsequent visits. We'll see you every 2 weeks until approximately 36 weeks, and then it'll be once a week thereafter. Now, of course, this is some general information, and your regimen, your course may change depending on whether or not you have any issues of pregnancy, like diabetes of pregnancy or high blood pressure pregnancy. In fact, that's what we're monitoring is your blood pressure near the end. You might get some urine tests to look for protein in your urine. We're monitoring your blood pressure, and you can expect a little bit more physical discomfort. It does become more difficult. You get more uncomfortable as your belly grows. Your intestines, your stomach are getting squeezed up, and so your baby wants you to eat more, but you have less room in there, so it becomes more and more difficult to eat large meals. That's why I encourage you to eat small meals, 6 meals a day. And again, remember, the liquids are easier than solids, and greasy fatty foods are kind of the hardest to digest. You also might start experiencing reflux in the symptoms, GERD or heartburn. There's a whole separate video about that. You can see that. You may also find that it's more difficult to sleep. You'll get up more often to go to the bathroom or just from discomfort. Sometimes pillows can help between your legs to support your belly. And whatever's comfortable for you. The reality is sleeping on your back isn't harmful if it feels okay for you. What you can get is something called IVC compression syndrome, inferior vena cava compression syndrome. What happens is when you lay flat on your back, the largest vein that comes from your legs and your lower part of your body travels up and it goes to your heart. And if you lay flat on your back, your uterus can sit on that, compress it, and interfere with your circulation. And what that does is it makes you feel anxious, makes your heart race. You won't feel correct and you'll sit up. So if you ever wake up in the middle of the night and you think you're having a bad dream, you probably rolled onto your back, and that was what was going on. All you need to do is roll to your left side, take a few deep breaths, and it'll go away in about 30 seconds. And also making sure you get a drink. For all the aches and pains that you're gonna have, more backache, if it's cooler times, you can get some abdominal support binders. There's all kinds on the internet or your local stores. There's binders that go all the way over your shoulders and around your belly that can help provide some support for your pelvis and for your belly. Not so comfortable when it's real hot season, but not bad when it's cool. There's also stretching that can help you. You can get on all fours like a cat, arch your back up, drop it down, relaxing while you do it. Get on your back, bring your knees up as if you're in the delivery position, but the purpose isn't to push then, it's to relax your muscles. There are other good videos on the internet, but a regular regimen of healthy stretching can make you more flexible and help you do better during the last trimester and also during labor and delivery. So around 36 weeks, that's a time where we want to know the baby's position to make sure the baby's head's down. That's called vertex. And if it's not down, then you might be a candidate for an external version. There's a separate video on that. But before that time, if the baby's not in position, they move a lot, it's okay. And that's not necessarily a bad problem at all. As you get further along, things get a little more crowded and the movements feel different. They're not quite as dramatic. So if you ever think the baby isn't moving as well, then you do some kick counts. There are different regimens to do. The one I like to advise is to lay in bed or lay on a couch, turn off your phone, turn off the TV, make sure you've had something to eat and drink, lay on your left side, put your hands on your belly, both hands, and count kicks and movements. As soon as you have felt 4, the baby's fine. If you haven't gotten 4 in 1 hour, then do it another hour, but you need 10 kicks in 2 hours or 4 in an hour. There are some variations of that, but overall, be sure you check with your own physician on their protocol, but that's a good rule of thumb. And if the baby isn't moving well and you don't meet those criteria at that late stage, that's when it's time to just go to labor and delivery. Contact your provider, but I just recommend going to labor and delivery because we really can't do further evaluation over the phone. It's time for you to get seen. You'll get modified instructions based upon your clinical scenario and what issues you have with your own pregnancy, but that's just a nice rule of thumb. We also have a separate video on deciding what to do about your mucus plug when that comes around this time, and also another video on figuring out if you're in labor. So this is kind of a general overview. I hope you found it useful. Feel free to leave comments. Thank you.